So hello, thank you for your nice introduction. So I want to start to show you a scan of a photon counting of our photon counting scanner. Actually, you can see here the wrist of Marc Kachelrieß. It's taken on our new alpha system on the right side, and we have reconstructed the scan on the left side to match the spatial resolution to an energy integrating detector. And as you can see on the right side, especially on the bone structures, the image is much sharper. The structures are clearly visible. And this is due to the ultra high resolution in the photon counting CT. Also here in this reconstruction, on the right side, you can see that the bone structure is much better visible. And also the soft tissue can be displayed very well. So we've heard already some details about photon counting this morning. I will just wrap up 4 things. So first of all, the photon counting comes with smaller detector pixels. And these smaller detector pixels can deliver ultra high resolution imaging without any dose penalty. And second, with the elimination of the electronic noise, we have an advanced image quality in obese patients. And we have stable, reproducible CT numbers for quantitative CT at low dose. Also, we have no downweighting of lower energy quanta, which will lead to an improved image contrast and also to an increased iodine contrast to noise ratio. And this can also lead to a potential dose reduction. And last, we have also the spectral information in photon counting CT. And so in every scan which we make, we have a dual energy reconstruction possible. And also right now in research applications, we have multiple thresholds. So as example, we can do separation of different contrast agents. So, but let's have a forward look in the detectors. So here, on the left side, we have the energy integrating detector, where the scintillator is used as the indirect X-ray converter. The photon here produces scintillation light, which is proportional to the X-ray energy. The light here is collected by photodiodes and then converted into electrical currents. And here we measure the cumulative signal of all the detected light pulses. And here on the right side, with the photon counting detector, we use a semiconductor as a direct X-ray converter. And these photons here create electron-hole pairs. And the number of these electron-hole pairs is proportional to the X-ray energy. And here we measure the individual photons, and this is allowing us a measurement of the energy information. Also, if we look on the right side, we can see, since we use smaller detector pixel, we have several subpixels in between of the lamella of the anti-scatter grid. So let's have a forward look what this means for our scatter. So here on the left side, we can see our energy integrating detector. We have a conventional anti-scatter grid, where each pixel is surrounded by the lamella of the anti-scatter grid. Here in photon counting detector, we have a coarse anti-scatter grid, where several subpixels are between the lamellas of the anti-scatter grid. So what does this mean for the scatter? So if we have a look here, we imagine a photon gets scattered at the patient. And if we look here, some photons which will be scattered will be detected by the subpixel. And some photons here, which are scattered, will be either attenuated or absorbed and won't be detected by the subpixel. So normally our scatter is a low frequency signal and it's not changing much between 2 neighboring pixels. But now with this coarse anti-scatter grid, we can have a change between the intensity of the scatter between 2 neighboring pixels. So let's have a forward look on a scatter distribution. So here for this experiment, we will merge our 4 subpixels to 1 macropixel. Actually, our scans in fullest collimation, where we have problems with scatter are done with in macropixel mode. So here around in gray is our anti-scatter grid. And in between these lamella of the anti-scatter grid, we have 6 different macropixel locations. So here on the right side, we have a scatter distribution averaged over the detector rows. And as we can see here, especially you can see it in the zoomed in image, we will have a change up and down in the intensity of the scatter. So if we now separate, if we're just looking on the left side of the anti-scatter grid or on the right side in one position, we can see that we are again, we don't have these high frequencies. We are seeing the low frequent components of the scatter signal. The same can be done also in Z directions, where we have our top, middle, and bottom rows. And also here you can see the changes of the scatter signal. So, but what does this mean for our reconstructed image? Let's have a further look. So if you're using a coarse anti-scatter grid, as used as in photon-counting CT, so some rings will appear. I think you can see it in the zoomed in image, perhaps even you can see it here. And it's like, it's Maier artifacts which are induced by the scatter. So we have to find a solution now to correct these artifacts. So I will shortly show you, we have recently shown the deep scatter estimation. The deep scatter estimation is a convolutional neural network which is trying to estimate the scatter just based on one projection. The deep scatter estimation can be either trained by Monte Carlo or by scatter measurements. And once the deep scatter estimation is trained, it will outperform other techniques. It will be also much faster than the Monte Carlo simulation. And also recently, we have shown that the deep scatter estimation can be used to correct cross scatter in a dual source CT. The network structure is a classical unit where we have as an input the signal, the primary plus our scatter, and the network will be trained to predict the scatter. So let's come again back to our coarse anti-scatter grid. To train our method, here we have done some Monte Carlo simulations. The geometry of our Monte Carlo simulations has been adapted to the Neotom Alpha. In total, we have simulated 16 different patients, where we're using 12 patients for training and 4 for validations. In total, we are simulating 14 different set positions at the patients, and each 10 degrees. And in total, this will lead us to around 8,000 paired scatter and primary data pairs. We have simulated the coarse anti-scatter grid, as shown before, where we are having the 6 different macropixel locations, which will be important for the next slide. Also, after doing some Monte Carlo simulations, normally you will do some smoothing, some Gaussian filter. Here, it's important to do this smoothing just across the same macropixel locations. Also, in the training and the validation of this, it is important to consider different scatter to primary ratios, and also to have a look at different clinical situations, and that the network will be trained to really see a lot of different patients and situations. So let's come to our actual network architecture. So as an input, we will have our primary plus our scatter. We will take the negative logarithm of it. And here, for our network input, we will have 6 different channels. Each channel correspondent to one of these macropixel locations. And also for the output, we also will have 6 different channels corresponding to one of these locations. We have a classical unit structure with a decoder and encoder. And in the end, we will just merge these different channels to obtain our scatter signal for the whole detector. So if we have a further look in our results, here actually we can see the blue curve will be the Monte Carlo simulation of our left columns, the orange one of the deep scatter estimation. And as you can see here, these curves are pretty accurate. They almost match completely. The same is for the right side. The green one would be here the Monte Carlo simulation, and the red is from our deep scatter estimation. So let's have a look in our reconstructed images. So here we can see our results. On the left side, we will have our ground truth image. Here in the middle, our uncorrected case, where we have a mean absolute error of 8.4 Hounsfield unit. And with the deep scatter estimation, the mean absolute error can be reduced to less than 1 Hounsfield. Also, it's important here, the results we're looking at are based on some simulations. Also, if we look at the zoomed in image, we can see that the rings and the Maier artifacts, which is clearly occurring here, can be completely reduced. Also, if we are looking at the amplitude in the uncorrected case will be around 30 Hounsfield unit. And with our method, the amplitude of the rings is less than 5 Hounsfield unit. So if we have a look at another case, here the mean absolute error would be about 8.8 Hounsfield unit. And also here in the difference image, we can see the scatter artifacts. And with our deep scatter estimation, these artifacts get clearly reduced. And also, if we have another look at our rings, these rings here, which are clearly visible here, are completely corrected here. So let's conclude this talk. So the small detector pixel as used as in photon counting CT and the coarse anti-scatter grid can lead to these Maier artifacts and has to be corrected. We have shown here a deep scatter method which can clearly correct these artifacts. With our method, the mean absolute error could be reduced from about 10 Hounsfield unit to less than 1 Hounsfield unit. And also the amplitude here was corrected from 30 Hounsfield to less than 5 Hounsfield unit. So our next logical step would be to apply this network in for real measurements in the prototype of the scanner. So thank you for your attention.
Very nice talk. This paper is open for comments, questions. Thank you.
Thank you for the talk. I was wondering, when the last bullet you had was going to real measurements, what challenges do you see, like going from the Monte Carlo simulations to the measurements? Do you foresee sources of scatter that are maybe not perfectly modeled in the Monte Carlo that will cause issues with the network when you go to the real measurements?
So actually, we already compared our Monte Carlo simulations to a scatter measurement, where we have done the measurement of the scatter with a small collimation and a high collimation to see how accurate our Monte Carlo simulation is. And it could be clearly see that for the water phantom, which we simulated and also measured, the scatter, like the Monte Carlo simulation, was pretty good.
So the result is definitely very impressive. You reduce the Hounsfield units from 9 to 1. So I was wondering, since you can do so good, have you thought about make it even better? So what are the things you need to do? In your framework, you could make it better. More cases, more training, whatever.
So also here, what we've shown was for one tube voltage. Also, you could generalize it to even have a look at more tube voltages. And also, but I think the results right now are pretty good. And yeah, we'll see.
That's very good. If there's no more question, let's thank the speaker one more time again.